Okay, so now that we've learned all of the different surface regions of the body and the names for those, we need a way of referring to them. Again, you will always refer, you're going to compare where two parts of the body are relative to one another. Okay, so if we think of this as far as directions, we might say, well, Amarillo is north of Lubbock, but it might be south of Nebraska. Okay, so we're talking about directions on the body, and it's two places relative to one another. Okay, so what I'd like to do is again go through the PowerPoint slide, explain these terms, and then give you some examples with some of the active learning exercises that I've created. Okay, so the first thing that we can look at here is that we have superior versus inferior. These words come in pairs. So if we're comparing two body parts, the one that's closer to the top of the head is superior. The one that's closer to the bottom of the feet is inferior. Okay, so superior, inferior. Okay, you may also notice in parentheses we have this word cephalad and caudal. Cephalad means closer to the head, caudal means closer to the tail. Okay, so these may be used interchangeably for superior and inferior. Okay, another pair that we have anterior, which is anything on the front, and posterior, which is going to be anything on the back side. Okay, so again, anterior front, posterior back. Now once again, you see that there are synonyms, words that mean the same thing, in parentheses. So some people, instead of saying anterior, they will say ventral. Some people, instead of saying posterior, they will say dorsal. And you'll even notice this whenever we learn the names of different structures. Some of them may be called posterior, something, 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 and some of them may be called dorsal, something, something, something. Okay? So you do need to know both sets of the words. The way that I remember which of these goes with anterior and posterior, sometimes I think AV. There's AV systems. If you're from this area, a lot of times I think PD, posterior and dorsal, PD, and I might think Paladura Canyon or Paladura High School, PD. Okay, so that's how I remember which of those go together. Okay. The next one that I want to talk about is proximal or distal. Now this is one that often confuses students, and so I want to be clear. So you can definitely know this, but I need to make sure that I'm clear. Okay, so generally you're going to talk about proximal distal whenever you're talking about either parts on an arm, parts on a leg, or sometimes parts from the neck up. Okay. Now in this case we're actually going to have three parts that we're comparing. Your arm is anchored to your body right here. Okay, this is the anchor point right at my shoulder area. And so we might say, okay, which body part, my elbow or my thumb, is closer to the anchor? So we've got three parts we're comparing. The anchor, elbow, thumb. Well, the elbow's closer to this place where my arm is anchored. So proximal means closer to the anchor point. So the elbow is closer to the anchor point than the thumb. The elbow is proximal to the thumb. The word distal, I think distant. or far away. So you could say the thumb is farther away from the anchor point than the elbow. So the thumb is distal. It's farther away from this anchor point than the elbow is. Okay, keep in mind the anchor point for your neck is going to be right here. And then the anchor point for your lower limb is going to be at the hip area. Okay, so that is going to be proximal and distal. Now, this other thing that I'm going to show looking right here on this image is medial and lateral. And actually, since those words aren't on the slide, let me write them out. We're talking about medial and lateral. Okay. So, looking here, if we draw an imaginary line down the middle of this individual's body, any part that is closer to that line is medial, and any part that is farther away is lateral. So closer to the middle, closer to the midline is medial. Notice all the M's. Middle, medial, midline. And lateral is farther away. Okay, let me look at my list and make sure. Okay, there's one other set that you should know. And that other set is going to be superficial and deep. So again, I think of the words. Sometimes if you think of a person and they're superficial, they're all surface. There's not much depth to them. They're just surface. Well, superficial relating to the body means the same thing. We're talking about things that are just on the surface. Whereas deep, you got to dig into the body to get to them. So if I were to ask you which is more superficial, your skin or your bones, hopefully you would say your skin is more superficial. Okay? And your bones are more deep. Okay. So, those are the terms, those are the definitions, and now let me show you your active learning exercise that might help you learn these a little bit more. Okay, so here is your active learning exercise, and we're going to look at 3 general regions right now and practice comparing them to one another. So up here I've got the orbital region for the eye. I've got the mental region, which if you'll remember is your chin, and I've got the manus region, which is the hand. Okay. So the first pair we're going to use is we're going to try and look at superior versus inferior. Which of these is superior or inferior? Now, if you remember, superior means closer to the head, and inferior means closer down to the bottom. So let's start for a minute, and let's just compare orbital versus mental. Well, we would say orbital is superior, and mental is going to be inferior. Okay. Well, now, instead, let's compare 2 different body parts. Let's take orbital out of the picture and put manus and say, well, which one, your chin or your hand, is superior? Well, clearly, your chin is superior. It's closer to the top. And your hand is going to be inferior, closer to the bottom. Okay? So, that's one way that you can compare these. Notice, depending on what we were comparing it to, the chin can sometimes be inferior. And again, when we compare it instead to the hand rather than the eye, well then the chin area is superior. Okay, so now let's use the terms medial and lateral. And if you'll remember, medial is going to be close to the midline, and lateral is farther away from the midline. Okay, so it would be moving that way along this image. This time, instead of looking at the orbit, which is the eye, I put the otic region, which is the ear. So we've got otic, which is ear, mental, which is chin, and again manus, which is hand. Okay, so for a minute, let's take manus out of the picture, and let's just compare otic and mental. Well, which one is closer to the midline? Well, mental is right along the midline. That chin runs right down the midline. And then ears are closer to the outside, farther away from that midline. And so they would be lateral. So in this case, the mental region is medial and the otic region is lateral. Now, let's keep otic in the picture and let's move mental out of the picture. And let's put manus back in the picture. So now we're comparing the ear, which is the otic region, and manus, which is the hand. Now in this case, which one is closer to this midline? Okay, and maybe it'll help to compare on this hand. Well, otic is probably about this far away from the midline. So about that far. But hey, manus is that far. So that means that this time, otic is more medial, it's closer to the middle, and manus is more lateral. Okay, so now what we're going to be comparing is proximal and distal. Remember, if we're talking about a limb, we're looking at the point of attachment, which would be right here for this limb. If it's proximal, it's closer to that point of attachment. And if it's distal, that means it's further away. Okay? The regions that I've labeled are the brachial region, which is this upper arm here, the carpal region, which is the wrist, and then the digital region, which is the fingers. Okay, again, for a minute, I'm going to take the digital region and move it out. So, which one of these is closer to this point of attachment right here? Well, the brachial region is clearly proximal, closer to the attachment, and the carpal region is further away from here. Brachial region this far, carpal region this far, so this one is distal, further away from this point of attachment. But just like we did before, now let's take brachial out of the way, and now let's compare carpal and digital. Well now, which one is closer to this point of attachment right here? Well, clearly carpal region is this far away, digital, I've got to go farther. So carpal is proximal, meaning it's closer to the point of attachment. Digital is going to be distal, or further away from the point of attachment. Now, what you may have noticed is that if you're comparing two things, you can end up with more than one correct answer. So, and that's okay. So let's look for a minute. Let's keep digital in the picture and instead compare it to oral. If you'll remember, oral means your mouth. Okay. So, if we were going to compare these, well, first we could say oral is superior and digital is inferior. Oral is above, digital is below. The other thing that we could say is we could say oral is closer to the midline, so it's medial. All right, here's our midline, right across here. Oral is going to be closer to that. And digital is farther away, so digital would be lateral. Okay. So my suggestion is, well, I would just pick random surface regions, put them on there, and then see Okay, how many correct answers can I come up with as far as superior, inferior, medial, lateral, distal, proximal, anterior, posterior? And get those where you just know them very quickly and very well.